Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Finger injuries and disorders. Introduction. You use your fingers and thumbs for everyday activities, from grasping objects or playing a musical instrument to typing. There are many injuries and disorders that can affect the fingers. Treatment for finger injuries and disorders depends on the cause. Treatment may include medicine, physical therapy, surgery, or other treatments. This program covers common injuries and disorders of the finger, as well as treatment options. The hand and fingers. The hand consists of 27 bones. There are 8 bones in your wrist called the carpal bones. The palm of your hand contains 5 bones called the metacarpals. The 14 bones in your fingers are called the phalanges. The bones are separated by special hinges called joints. Muscles make the bones move on their joints. You can grip objects with your hand because of the muscles located in the hand and the forearm. Each muscle is formed of 2 parts. The fleshy part of the muscle contracts and moves the bones. The tendon part of the muscle extends into the hand and attaches to the fingers. The forearm muscles are attached to the bones of the forearm at the fleshy part. The muscles narrow down and become tendons through the wrist and into the fingers. They attach to the finger bones. When the fleshy part of the muscle contracts, the tendon is pulled toward the forearm like a cable. The fingers bend. Some of the tendons are covered by a special tube that contains fluid. The fluid makes movement smooth and painless. The tendons and their covering tubes are held in place by a specialized covering called a sheath. Symptoms. Many finger injuries and disorders have similar symptoms. The main symptom is pain in the finger or surrounding area. Other common symptoms of finger injuries and disorders are bruising, difficulty moving the affected finger, 1 or more small lumps under the skin, swelling or weakness in the wrist or finger, trouble pinching or grasping an object. Some finger injuries and disorders may also cause curled fingers, redness or tenderness at a joint, stiff, achy joints, visible finger deformities. Talk to your healthcare provider if you notice any of these symptoms or other changes. Finding a problem early makes treatment easier in most cases.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Fractures and dislocations. A fracture happens when any one of the bones in the body breaks. Fractures may affect the bones that form the finger, including any of the phalanges. A fractured finger usually happens as the result of an injury to your hand. For example, a fracture can happen if you jam your finger, put out your hands to break a fall, slam your fingers in a door. Treatment depends on the severity of the injury. If the bones are still in place and are likely to stay that way, the finger may be placed in a cast or splint. Surgery may be needed to treat more severe fractures. This may be when the joint is not stable, or if a bone has broken through the skin. Pins, screws, or wire may be used to hold your fractured bones together. You may need physical therapy for a few weeks or longer to help regain strength and motion in the injured finger. Dislocations are joint injuries that force the ends of your bones out of position. A finger dislocation happens when any of the phalanges slip out of their proper placement. Finger dislocations often happen if a finger is jammed or forcefully twisted or bent. They can also happen if the finger is bent backwards. Dislocated joints often are swollen, painful, and visibly out of place. You may not be able to move them. A dislocated joint is an emergency. If you think you may have one, seek medical care right away. Treatment for a finger dislocation might include a splint, bone repositioning, medicine, rehabilitation. When properly repositioned, the finger joint will be able to function and move normally again. Osteoarthritis. Arthritis is a common condition that causes swelling in and around the joints. It usually leads to pain and limited movement of the joint. Osteoarthritis is the most common type of arthritis. It can affect any joint in the body. The joints between the fingers are most commonly affected. Osteoarthritis is more common in older people. Osteoarthritis happens due to repetitive use of the joints. Repetitive use of the joints leads to wear and tear on the cartilage in the joint. Grinding and crackling sounds come from affected joints when they move. Osteoarthritis not only causes pain, but can cause swelling and stiffness of the joint. Bony lumps are common. They are mainly seen on the finger joints. Unfortunately, there is no cure for osteoarthritis. Anti-inflammatory medicines, physical therapy, and splints may help. If other treatments are unsuccessful, surgery to fuse or replace joints may stop deformation and restore use of the joint. Tendinitis. Tendinitis is a common condition. It causes swelling around muscles and bones, including those in the hands and fingers. Tendinitis is usually caused by overuse or by repeated injury to a certain area. People who do activities that require repetitive motions or that stress the joints are at a higher risk for tendinitis. Inflammation of a tendon may also be caused by arthritis, diabetes, infection, old age, thyroid disease. Treatment focuses on healing the injured tendon. The first step in treating tendinitis is to reduce pain and inflammation through rest, wrapping the affected area, elevating the injury. Over-the-counter anti-inflammatory medicines such as aspirin or ibuprofen can also help. Your healthcare provider may advise you to limit the amount of activity involving the affected joint. In some cases, protective devices such as a splint may reduce stress on an inflamed tendon. For severe cases of tendinitis, you may receive an injection into the area around the swollen tendon. Other treatments may include dry needling, ionophoresis, therapeutic ultrasound, physical therapy. Surgery may be needed to repair the damage if there is still no improvement or if a tendon is completely torn. After surgery, an exercise program is needed to strengthen surrounding muscles to prevent repeat injury. Other disorders. Other disorders can affect the fingers as well. These include Dupuytrenâ's contracture, trigger finger. Dupuytrenâ's contracture is a hereditary thickening of the tough tissue that lies just below the skin of your palm. It causes the fingers to stiffen and curl. The cause of Dupuytrenâ's contracture is not known. It is not caused by an injury or heavy hand use. There is no way to stop or cure Dupuytrenâ's contracture, but there are treatments. Dupuytrenâ's contracture usually progresses slowly and may not become troublesome for years. It may never progress beyond lumps in the palm. Needling is one treatment option. In this technique, a healthcare provider uses a needle to break apart the cord of tissue. Enzyme injections are another treatment option. The healthcare provider first injects medication to soften and weaken the tissue. Next, the healthcare provider uses his or her hands to straighten your fingers. Steroid injections and splints may be used to treat Dupuytrenâ's contracture. If the disease is progressing, surgery may be needed. Surgery for Dupuytrenâ's contracture divides or removes the thickened bands to help restore finger motion. Trigger finger is an irritation of the sheath that surrounds the flexor tendons. When the tendon and its covering become inflamed and swell, they are unable to move in the sheath and the finger remains bent. Occasionally, the tendon releases and the person feels a pop. Moving the finger is less smooth and may become painful. Trigger finger is usually the result of repetitive movements. Avoiding repetitive motion may help with the symptoms. Oral anti-inflammatory medications may be tried for reducing swelling. Steroid injections around the tendon may also reduce swelling and promote healing. Your healthcare provider may recommend using a needle to open the tendon sheath. This is called percutaneous release. When all else fails, an open operation may help. The surgical procedure aims at taking the pressure off the tendon by cutting the sheath. This frees the tendon and its movements. Carpal tunnel and cubital tunnel syndromes can also affect the fingers and hand. These disorders may cause numbness in the hand and fingers, as well as weak muscles. The carpal tunnel is a narrow passageway of ligament and bones at the base of your hand. It contains nerves and tendons. Carpal tunnel syndrome is when irritated tendons thicken and cause the nerve to be compressed. Cubital tunnel syndrome is a condition caused by increased pressure on the ulnar nerve. The ulnar nerve runs through the cubital tunnel in the elbow. Treatment for carpal tunnel and cubital tunnel syndromes often involves medicines, a splint, and physical therapy. In some cases, surgery is needed.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. You use your fingers and thumbs for everyday activities, from grasping objects or playing a musical instrument to typing. It can make life difficult when there is something wrong with your fingers and thumbs. There are many injuries and disorders that can affect the fingers. Some examples are fractures and dislocations, osteoarthritis, tendinitis, Dupuytrenâ's contracture, trigger finger. Many finger injuries and disorders have similar symptoms. The main symptom is pain in the finger or surrounding area. Other common symptoms are bruising, swelling, or weakness in the wrist or finger, difficulty moving the affected finger, one or more small lumps under the skin, trouble pinching or grasping an object. Treatment for finger injuries and disorders depends on the cause. Treatment may include medicines, surgery, or other treatments. Talk to your healthcare provider if you notice any symptoms. Finding a problem early makes treatment easier in most cases.
Thank you for using Explain.